Are you suffering with reoccurring back pain? If so, then this video is for you, because whether you get it every few days, every few weeks or months, it doesn't matter. The main thing is that what you're doing to relieve it is just calming the symptoms and not actually fixing the problem. And in this video, we're going to look at what you can do differently, how you can help yourself, and how you can prevent yourself from getting that reoccurring back pain. Hi, I'm Jared Rains, and this is Rapid Relief Injury Lab. In this video, we're going to go through a few things. To start with, again, you are just fixing the symptoms. How do we know? Well, if it's reoccurring, people say, oh, it's just tight, or it's sore or tender or something like that. If it's tight, that may be the case, but why is it tight? Often, the reason a muscle is tight is because it's overworked. Why is it overworked? Well, often it's overworked because it's taking too much load, often because somewhere else nearby isn't taking the load that it should. Why is it not? Well, there can be many different reasons, but that's what we have to figure out. What happens if we do figure it out? We often find, so often, that the issue is fixed very quickly, relatively quickly, depending on how long that person has had it for or what the root cause is. But in the recovery room here, we have so many people with back problems and they leave feeling so much better in just one session. Now, the hard work needs to be done outside with exercise to, first of all, get it to a point where it doesn't help and is fully healed and well, not healed, but recovered. It's not being overworked. And then the job of you is to ensure that it doesn't happen again by preventing it with the clear steps that we give you. But it's amazing. So many people come in so much pain, and once we figure out what the driving force is by analysing your movement patterns with different things such as your gait, walking, with hinge patterns and pressing and pulling and things like that, we can quickly determine what the issue is. Once we do that, then there are some clear-cut ways to get the load to be shared and balanced within the body, and that can be restored pretty quickly. Once load is taken off of the muscle that's overworked, it calms down. Your body then feels safer, it knows what it needs to do, and you can go away, take that, and in the week or two after, improve it even more so. So let's take your back pain right now. So a lot of people come and they have this lower back pain, they say, and they've had a massage, for example, and it's loosened it up, it felt better, but then it's come back. And that's because the massage has just loosened the tissues, made it feel better, but it's not resolved the issue, and that's why it's come back. So what do? Well, we can use some hands-on manual therapy. Why? It makes people feel better. It does relieve the tension. It calms down the inflammation of the area. That's great, but that's not the main thing we want to do. Say we have this low back issue. We have to then look, is it the core? Is it the hips? Is it a tilt problem? Is it your glutes? This is probably the biggest thing that people don't know. And that is, many people don't have active glutes. Even if they train them all the time, they don't work in general. A simple thing that you can do at home to see how good you are is if you stand tall and you're going to squeeze your bum. So you're squeezing your bum and you can feel your bum tensing up. Great. What we often find is when people start to lean forward, to hinge forward, they lose that control, that ability to squeeze their bum. So I want you to try that, test it out. If you get to down here and you can't squeeze or it's very light, that means your mind-muscle connection with your glutes isn't very good. And that's why so many people injure themselves picking something up. Because even people that are like, oh, I train and I work on my glutes, that's great. But can you do it when it's extended? How good is your mobility, so your strength in extension? And that's often a struggle for people. So one major thing that we often do with people with lower back issues is an isometric glute bridge. That means a hold in a glute bridge position, and that then gets your glutes, that are big powerful muscles, to fire, and they then take the load off of the back. And that's just one example, and there are obviously many other things that could be causing it. There might be a secondary issue. There might be something that has to happen before your glutes work in order to get them to work. There might be an underlying issue there, and that's what we have to figure out. But you'll never get rid of that back pain if you keep treating the symptoms. So if that sounds like something that you need a deep dive into your issue to find the root cause, then book your injury lab assessment right now, and we can get that issue sorted for you as soon as possible and help you to not have to have that issue ever again.